We are here in this panel discussion where we will be talking about achievements, we'll be talking about our flaws, so that people in all over the world, wherever we are, we can do and more to make those flaws get corrected. So with our Director General, Dr. Dhiman, we have now our next panelist, whom I can request is Dr. Ahalya Sharma, following to which we'll invite Dr. Balendu Prakash, sir. So we go with the queue. So let's have the perspective from Dr. Ahalya Sharma here. Madam, I think you need to unmute your button because we are not able to hear you. So.
Sorry. Namaste and a very good morning to all of you. Respected panelists, Dr. Dhiman sir, Dr. Balendu Prakash, Dr. Sriranjini. Very good morning to Dr. Satyam and team. Dr. Dhiman has so far covered most of the aspects that have to be done in integrated cancer care. As an academician, I would probably look at things in this particular perspective. Integrative medicine, the use of integrative medicine in cancer therapy is happening. And as rightly pointed out, the documentation, the data collection is not very clear, is not in a big way. And that is because the lack of confidence is one. The lack of the knowledge to where to report is another one. So with this scheme, I would say we need to bring in changes in the curriculum as to how students can be helped to understand this. You know, most BAMS practitioners, very few of them have the kind of ability to develop it on their own. So how could we help them? How could we bring in most of the new age diseases that we are very commonly seeing? For example, polycystic ovarian syndrome. In fact, after a lot of trials came in with Vamana and polycystic ovarian syndrome, people, the doctors started realizing, and now it's become kind of the first line of treatment in a very similar way in those diseases, in those kind of cancers that are very common, like breast cancer, for example, which is about 32% in India that we see. So very clear protocols can be added. In fact, all that Dr. Dhiman spoke about until now, that can actually come into our curriculum, and students would definitely be able to pick it up and start practicing it much more. The other more important one that I see is that in the postgraduate curriculum, such protocols and studies can be included so that with specific guidelines, so that the students, the postgraduate scholars can take them and go about it and contribute to the work that is already going, by which we build up a larger body of knowledge. So the work that is happening needs better documentation, as has been already discussed. Standalone Ayurveda in cases where possible, that needs to be there. And the third one is that where can we have the right integration, at what stage and what time? And as sir was pointing, once the Society for Integrative Oncology becomes more active, then it would be probably the right way for the practitioners to go about it. However, having said all this, I must also mention that we have all had cases, we've all seen patients where our medicines have given substantial relief. In fact, if time permits, I would like to quote just one example, one of my case studies, where I had treated the lady for infertility, and a 32-year-old woman who had a previous history of fibroadenoma, and which incidentally started growing once in her 4th month of pregnancy, in the 2nd trimester. And again, FNAC was done, which confirmed that it is a fibroadenoma. And therefore, she was just left alone. But by the time she entered her 7th month, we realized that it was a very fast-growing tumor and a malignant one at that. The second biopsy confirmed it. And post which, she was very particular that she didn't want to lose the child. So it was here that we had integrated our medicines along with the radical surgery. And the patient continued to do extremely well for the next 2 decades of her life. This was a very early case that I had treated. Many such cases where patient has not been able to withstand chemo, and the results have been pretty good. So these are some of my thoughts on how to integrate at the level of curriculum is what we have to think about at this stage. Thank you, Satyam.
Thank you, madam, for really giving us the insight where academical part has to take place. We will now try to hear from Dr. Vaidya Prakash, following to which we'll ask Ms. Diane Finlayson to give her inputs. So let's start with Vaidya Prakash, sir. Sir, you have to unmute your button, please.
Good morning to all. Respected DG CCRYN and all other panelists. First of all, I would like to thank Mr. Satyam for inviting me on this important discussion. So cancer had been a big challenge to the world, and initially everybody thought that it could be killed like killing malaria. But this approach had been practiced for years. Their target was to kill cancer. And I recall that in 1996, Nixon, who was the former president of America, he had initiated a war against cancer in 1971. And after decades of efforts, they realized cancer cannot be cured, cancer cannot be won by killing. Cancer should be treated as a preventive tool. So here is Ayurveda. Ayurveda is based on Swasthasya Swastharakshanam, Aturasya Vikar Prashancha, maintaining the health of healthy and treating the disease one. I think this entire line has the crux. You can keep a person healthy by keeping immunity intact, by keeping the metabolism intact. So all teaching of Ayurveda, whether it's a lifestyle or drug or living way or thinking way, whatever it is, man, buddhi and sharir, where we say mind, body, these are all together. And I think the situation has started in the right direction, because I born in a family and I recall that my father had treated incidentally first case for 3 cases successfully in 1960 by using Ras Shastra, which is one of the dying science of Ayurveda. It deals with the therapeutics of mercury and metals, processed metals and other minerals. So here we talk about homeostasis. Our body produces nearly 300 trillion cells every day and they die same day. But why this happens that certain tissues, whether it's the marrow or the breast or bladder, they start making abnormal cell, and when they start killing surrounding cell, that is the cancer process. Like a terrorist in the society, we can say it is a terrorist within the body. So to normalize this homeostasis, that if we can keep the balance. So I think Ayurveda, whatever Dr. Ahliya said, Dr. Dhiman has said, that whatever is being done, it is in the right direction. And I'm very happy that my decades-long efforts treating cancer, because there was a time I was standing alone in the treatment of cancer in the country. But there is a big change with the new leadership and new sort of process, because there was a time when we were thinking that West will do everything. So this sort of panel discussion, this sort of meeting of mind and the efforts, I am very optimistic that cancer could be only cured by doing preventive model, and second thing, by giving some adjuvant therapies, first to prevent or to delay the relapse and to extend the life. So with these words, I say thanks to all panelists and the organizers for inviting me, because I had been doing this for decades, and anti-inflammatory, Ayurveda is anti-inflammatory, Ayurveda is immunomodulatory. So these benefits of Ayurveda, whether it is a plant or mineral or animal origin, that should be combined, and then we can look for a bright future for the cancer patient. Thank you very much.
Thank you, Vaidya Prakash, sir, for sharing this to us. We need to understand from the academic point of view, where does Ms. Diane Finlayson feels that we need to upgrade, and what are the things which has to be done, because of which she feels that Ayurveda somewhere is lagging behind.
Thank you. Thank you so much. And thank you very much for the opportunity to spend some time with you all this evening in this very important discussion. I am taking the educator's view here, and let me just get my right slide up from the beginning. Thanks here. Boom. I just have 4 slides. I am an educator. I'm from the US. I'm looking at this from a Western point of view. And I'm a department chair for yoga therapy and Ayurveda department at the Maryland University of Integrative Health. So I think that some very good points have already been made as I've been listening by the other doctors. And some of the key problems in my mind with not just Ayurveda, but other integrative and complementary methods has to do with credentialing, licensure, mechanisms for insurance reimbursement, and, as has been mentioned, the lack of peer-reviewed research on our modality. I think this is compounded in the case of Ayurveda because it is frank medicine in India, and there is not a way for it to be appropriately honored or licensed in the US. And this creates a competitive attitude with Western doctors who don't understand the modality. And again, having that peer-reviewed research that can help conventional Western practitioners understand the modality in which we're working so they can better understand its efficacy would be a great boon to the modality that we're working with. In the West, I'm talking about in the West, what I see happening often is that Ayurvedic education is run really in small businesses that are primarily lineage-based or lineage-driven programs. And they're promoting the lineage and the way that medicine is done in that lineage. There's a larger focus on the learning of not just the transliterated Sanskrit, but Devanagari, which becomes an obstacle to some people who would be very good at Ayurveda being able to move into the modality. And also a lack of biomedical science, not to replace in any way, but so that the student can become conversant in both languages, if you will, and present case studies and peer-reviewed literature that can also help educate Western colleagues who may wish to collaborate and use these modalities. We also need to make sure in the curriculum that there is not only the Ayurvedic understanding of pathogenesis, but the biomedical understanding of pathogenesis too, so that, again, I am focusing highly on the ability to, in the West, educate the Western practitioner on how we can collaborate and be effective colleagues in the treatment of cancer at various stages. Let's see. And this is what all this is about too. So again, the lack of institutional partnerships that could create collaborative relationships is important too. If in the West we can find ways, the programs I've worked with have had the good fortune to be able to work in places like the Maryland Proton Treatment Center and offer some light Ayurvedic approaches because no one's licensed, they can't use herbs, they can't do frank medicine. We can do some yoga therapy and we can show the efficacy of what we're doing in survivorship to promote better better recovery from chemotherapy and radiation. But until we can get in and do practicums and partnerships with institutions, it will be hard for them to allow their IRBs to work with universities. And most, again, where's the research going to be done? Where's the peer-reviewed research going to be done? We've got to have it. We've got to have a committee. It's got to be an institutional research board or review board. There are ways that these things have to be done to be looked at as credible with Western practitioners. So there's kind of a loop. If we can get a practicum and people can see the efficacy of our work, then they may be interested in providing some financial resources to support randomized clinical trials or the writing up of case studies and better research. And so why do science and research matter? Because, and I'm going to harp, until Western medical professionals, conventional Western medical professionals understand what it is we do and how we can be of benefit to the patient, how this modality can add value to the patient's quality of life, they're not going to consider us, because most Ayurvedic practitioners aren't coming out of schools that are equivalent to medical schools in the US. There's not a good reciprocity with BAMS in the US. So we've got a lot of education to do, and we need to create partnerships so we can get that research going. And that's pretty much what I have to offer. So I thank you so much, and it's been really good to hear what other doctors, I am not a doctor, I'm an educator, but what other doctors are thinking, and I look forward to hearing what everyone else says. Thank you for giving me this opportunity.
Thank you, Ms. Diane Finlayson, for this. We all will be staying here for this panel discussion for long, because currently we are only here as panelists. Later on, all the attendees are going to join, and there will be questions from all of them, looking into whatever we are discussing now. So following to this, I will request Dr. Nitin Patil to come forward and express his views. Dr. Nitin Patil.
Yeah, good morning. I congratulate Dr. Satyam and his team for organizing such a wonderful event. It's a need of ours. We have a lot of opportunity, at the same time we have a lot of challenges in the integrative oncology. I will restrict my thing in the integrative oncology to the Ayurveda and yoga, how to do with conventional, what are the opportunities and challenges. I feel personally, and I have been putting this thought in several platforms, and I would like to share those thoughts again here. Integrative oncology is a need of ours, as there are a lot of challenges in the present healthcare system when treating the oncological cases, because even though with all the advancement, we are facing a lot of challenges in maybe better healthcare provided for the oncology patient. That's where Ayurveda and yoga role comes. But unfortunately, we are practicing Ayurveda and yoga as a two different faculty or specialty. But when we look back and go to the roots of the whole concept, when it has been written by our ancient rishis, the Ayurveda yoga never has been thought. It's a two different thing. Unfortunately, today also we have that's how Ayurveda panel is different from the yoga panel. Why I'm trying to bring this here is Ayurveda is meant for the physical focus and the yoga is meant for the mind. Unless and until we have this Ayurveda and yoga come together and practice together as a whole, then only it is possible to have a better integration. Because both Ayurveda is incomplete without yoga, and yoga will be incomplete without Ayurveda. Because Ayurveda, as yogena chittasya padena vacha malam sharirasya cha vaidakena, yoga is focused on the mind, and Ayurveda is more focused on the body part. So we need to do a cleansing and maybe a dinacharya, rutucharya, along with the mind by handling with asana, pranayama. That's a thought. Even unfortunately, today we have in India, there is separate council for the Ayurveda, separate council for yoga. But these things come to, these are all the challenges, what I feel personally. When we can able to do, this will be better. And where to start the integration? Integration can be started at the level of yoga initially, because yoga is a non-invasive procedure. It is easy to integrate. Otherwise, it will be a lot of challenges in research as well as the clinical services. When it comes to Ayurveda, later we can slowly start incorporating. There are already model, which is already shared by the several my panelists. So these are my thoughts regarding the integrative oncology, where to start, how to start. It can be started at the curriculum level. Later, it can be percolated to the deeper in the clinical practices and the research. That's what. Thank you again for the organizer giving me this opportunity to share my thoughts on the opportunities and challenges in integrative oncology, having the emphasis on Ayurveda and yoga. Thank you.
Thank you, Dr. Patil. It was nice to hear and understand how and what you think. Following to which, Dr. Sriranjini from Canada, we want to hear from your side and your perspective that why and how Ayurveda is still lagging behind, and how we can do something in terms of either academics or in the form of research to bring it very close or mingle totally with integrative medicine. Dr. Sriranjini, please.
Namaste, everyone. Respected panelists and all the other listeners out there. Thank you, Dr. Satyam, for this wonderful opportunity. So, like Dr. Dhiman ji and Dr. Ahalya and Dr. Prakash ji and even Dr. Patil were telling, there are a lot of things that need to be done. There are some things which are already being done. Where we can add value to start with would be a good page on cancer and Ayurveda, which is out there on the internet for anybody to search and get information about. Now, currently, if you Google cancer and Ayurveda, you get a whole lot of things which have absolutely no validation and which at times are even dangerous for patients to be seeking. So if we can collaboratively come up with a centralized documentation, maybe from the governmental bodies, wherein we can come up with a standard protocol of how Ayurveda diagnoses or how Ayurveda manages cancers, what are the options available. There are things which are on the scientific publication domain. So, but most of the general public would not have access to this information at first hand. So if there is something on these lines which could be done maybe by CCRYN, CCIM and the Ministry of Ayush, wherein we can come up with a web page which gives a lot of information on which are the standard guidelines which are currently being used, which are the centers, the identified centers for integrative management with yoga, Ayurveda and so on, which are already doing wonderful work in this domain, and then go on to give more information related to what are the scientific publications already available. So if we could come up with something like this, I think this will at the outset give a lot of scope for Ayurveda to grow further, because patients seeking Ayurveda, seeking yoga will automatically increase because it is now well informed. People know what needs to be done. And the first thing that we always look for any information, you want a mobile phone, you go to Google search. So if Google search can give authentic information regarding how cancer in Ayurveda and integrative approach is working, has been working so long, and how it is, what is the path for the future, I think this will be a wonderful effort. So that would be my inputs for the current discussion on what can be done to take Ayurveda and cancer treatment further. Thank you.
Thank you very much, Dr. Sriranjini, for putting your inputs. So I will request all the panelists to switch on their mic and camera so that we can slowly enter into the discussions now. Before we go ahead, I will like to give you some important informations. We are also, by the end of this session today, we are going to release our souvenir, and in the presence of our DG sir and other panelists, we take this opportunity that, and we feel blessed that we can do that today. We have got more than 75 abstracts from all over the world related to yoga, Ayurveda, and cancer. And all those informations are there with you all as torch bearers for the same. So we'll be doing that around Singapore time 11:45, which means exactly 1 hour from now. After 20 minutes, we will allow this panel to be open for all the attendees. So you may be able to see around 50 or more attendees who will be attending along with you, and they will be asking questions. So that will be the second update. And now we are here another 20 minutes to discuss among ourselves what we all have given inputs. So starting from our DG sir, what DG sir is trying to say, and that clinical trials has to be properly registered, because when that doesn't get done in a better way from the very beginning, everything whatever we are doing, it is not properly documented, and that the input which the CCRYN is trying to do and put into all the research, that cannot be done properly. So anyone else wants to add on this? Principal Dr. Ahliya Madam, how do you ask our listeners, our viewers to really follow what DG sir has said? Because this is a very important thing. We have to have which I personally also feel, everything has to be a proper centralized way. And if the centralization we all will follow, then this is the best way we can really move our holistic medicine in a proper way.
Yes, Dr. Satyam. As Dr. Nitin Patil was mentioning, the challenges and opportunities are very many. We have both of it. What is important is to notice, it's only now that we are coming together as a national body, as a nation, trying to bring this together on one platform. That's something we need to remember. And there is a constant evolution for the better that is happening both in the Ayurveda education and in the Ayurveda healthcare. As I was mentioning, there are a lot of diseases for which clear protocols have now been in place. They have been put in place. A lot of clinical research that has taken place is available for everybody to go through. The world over and us together, the practitioners, the patients and the practitioners actually look for evidence, and therefore, they look for evidence in terms of clinical and look for evidence, and a body of the scientific mind in Ayurveda coming together to deliver this will be the best thing to happen. And as sir has already earmarked so many practices, clinical case registry, ensuring comprehensive clinical documentation, work that is happening here and there. In fact, I remember here in Karnataka, there used to be some folk practitioners who were treating for cancer from their family. They were not registered, people who had gone to a college. But there was a lot of good things that was happening around. And when we went to document it, there was hardly any information available for us to do. But things have gradually moved on. A lot of work is coming on, even in the colleges. So we need to concentrate, we need to put them together, bring it under one head. And as Dr. Ranjini was mentioning, the authentic information available on the web is very, very important. And I'm sure the such things will come up. The transdisciplinary team that madam from US was speaking of, this is where this is what we are actually facing the challenges. And once these are addressed, a comprehensive policy worked out, a lot of us who are working can actually put our trials there, put our case studies there, and that should be important. In fact, the black box study is actually a good thing for all of us, because we follow our protocol and give the pre and the post results. So it should be good.
In education system, Ms. Diane, we think that we should start from the very beginning, like how entire system has to start with, like from the very beginning, from the first year, even though the person is a therapist or a doctor or a practitioner, that we need to know that one body who is trying to work to make sure that everything has to go systematically. So what is your say on that?
So it's interesting. Thank you for the opportunity to speak on the educational system. So one of our problems in the West is that people who are being trained in the US in Ayurveda are not being trained in accredited schools. And so they're not being looked at as peer to or equal to, say, a doctor, a Western conventional doctor. So then when that person who's been trained in what I'll call a community school, who may have excellent training as an Ayurvedic practitioner, but often not as a doctor, not as an Ayurvedic doctor. There's nobody training in the US BAMS, to my knowledge. There have been some schools that have done graduate preparation, but it's at a lower level. It's not the same system as India. It's not the same level of medical training. It's different. So now for us, we don't all understand what the BAMS does, and we're trying to create understanding and collaboration with the Western conventional doctor, but the practitioners don't often have graduate level education. So in order to run a clinical study, you need to either be part of a hospital or a university that has a board that will be an independent reviewer of the research. And that research has to be run, if it's medical, by the principal investigator must be a medical doctor. So right away, we're fouled when it comes to creating what's going to be looked at as authentic research. It would be good too if one of the, and perhaps I'm mistaken, but I'm not sure that there is an Ayurveda journal that is part of PubMed. If we could find doctors who could create research that could be listed in PubMed, that would be very helpful in the West. But we also, in the West, need to find a way to create graduate prepared Ayurvedic practitioners that are being trained at a higher level. I think that is very important, because right now in the West, you say you're doing Ayurvedic work or you're an Ayurvedic practitioner, and they say, oh, I took a quiz online, you know, and it's very disheartening.
Correct. Thank you very much, Ms. Finlayson. So we understand that you were talking about the entire academic level on that side in the West, whereas there are certain people who are asking questions, which I'll ask to address by Dr. Sriranjini, or at the same time with our Director General Sir also, that there are some Ayurvedic physicians, they have been in very good in their academics at one point of time, or they might be now also. But when they look into the standards which has been fixed by CCRYN, they say that everything we have studied in Sanskrit and everything was in Sanskrit, and what we are doing in the research now is quite in the other side, which is quite Western. So like, why is it the need of doing research of an Ayurvedic medicine and Ayurvedic protocol in a westernized way, you know. So because Dr. Sriranjini, I know that she has high amount of experience on research, and we have Director General Sir here who is heading to the entire department. So one by one, can we understand this questions answer? Dr. Sriranjini first.
Shall I go first? Yeah, okay. So I would just like to add to what Ms. Diane just mentioned, that there is not PubMed indexed Ayurveda journals, but there are a few of them. There is the Journal of Ayurveda and Integrative Medicine. We have AYU, which is PubMed indexed. So we do have a few journals which are currently PubMed indexed and which follow the same guidelines for publications which are followed by all the peer-reviewed journals. JIM, for example, is an Elsevier publication currently, and IU is independently hosted by the institute. So CCRYS has been doing tremendous work through their nodal centers throughout India. So most of these centers are integrated with contemporary Western biomedical centers. So one of the centers where I did my PhD from was NIMHANS in Bangalore, where we had the Ayurveda Research Unit attached to the National Institute of Mental Health and Neurosciences. So we do have many such centers across India, which is currently doing good work. The fact of the matter is that we started a little slow. So for example, when I finished my post-graduation, the amount of research methodology and statistics that I had learned did not prep me for getting into a career in research, which is a shortcoming which we felt, say, 15 years back when many of us completed our post-graduation. But now there has been tremendous effort on the part of the institutes as well as the Central Council, wherein they do periodic workshops on research methodology, on statistics, to train faculty, to train postgraduate students to be able to better adapt to the fast-growing research field. Now, why are we using modern research methodologies, and why are we not using Ayurveda research methodologies? Well, to develop a research methodology takes decades together at times. So it is a lot of effort to develop a new research methodology. And I don't think we have that much of time right now. Time is not in our, is not right now. We need it immediately. Now, whether I call Shula or whether I say pain, I think there are some things which are very similar. Now, if I can use a visual analog scale to grade pain, to grade Shula, I think it is more or less. I'm not doing any harm to Ayurveda. I'm not being not following a true follower of Ayurveda. So I think currently we don't have the time to develop our own research methodologies, though I do agree that yes, we do need to come up with rating scales, validation scales for validated rating scales for symptomatologies in Ayurveda, because many a time the correlation is not one-to-one. When we say Ayurveda understanding of Amavata, it is very different from what we would use for, say, rheumatoid arthritis. In a rheumatoid arthritis scale, you would only look at the joints. But when we are talking about Amavata symptomatology, we give a lot of importance to the gastrointestinal symptoms, right? So many a time it is not one-to-one. So blindly following contemporary research tools for validating Ayurveda may not work all the time. But we need to start somewhere, right? So for that, I would say that if we are using a little bit of Western already developed standard research methodologies, it should be quite fine.
Same thing goes for DG sir also, that DG sir, we had this question was that many Ayurvedic physicians, they were very good academicians at one point of time with a lot of shlokas, lot of information. But when they say that the way how Central Council of Research in Ayurveda Science has been growing and the entire thing is very much westernized and they are going to furthermore westernization, which we do agree, as per Dr. Sriranjini, what she has said, that we don't have enough time to have our own different research methods and different way. So what is your say on that? That why is CCRYS going towards more westernized way of research?
Thank you very much. Dr. Satyam, I'm coming with two viewpoints. One which Dr. Diana took a stock of the Western medicine in the US and status of Ayurveda education there, and the collaboration in the research part. So this depends upon the demand and supply. If they agree that the status of Ayurveda education in US is very low and they are trained by here and there small schools, what question is whether the government and the public of US needs Ayurveda for integration in cancer and other diseases. If it is, then they should demand from the government of India. There are highly qualified and well-versed researchers in India who can come there and who can guide on the protocol as well as the ongoing the continuing research which they want to do there. That is no issue. The how to sensitize the Western doctors, that will come with the evidence. Once such an collaborative research is conducted in their country under one roof in the cancer unit or hospital, by integrating Ayush as a whole system approach, and they see the outcome, they will certainly like to understand Ayurveda, what is Ayurveda, and then they can be subjected for authentic Ayurvedic education in India. That part can be met, but the question will not only be solved by discussing among we people which are nearly not involved in the policy and decision making process. So this has to be the demand of the country and the country government. Then and then this can be. And second part which Dr. Sriranjini was telling, certainly 5 years back, a big meeting in India happened among all systems of medicine with modern medicine, where government took a stock of the integration of both systems, and it was agreed upon unanimously because we put the IU systems, alternative systems, put our viewpoint that whatever research is going on, it is only enriching and reflecting the outcomes of the modern medicine through modern way. But our principles, our whole system approach is not being reflected. So it was agreed upon that there should be an integrated research protocol. And Dr. Sriranjini is very right. It takes decades. It takes decade. And I started the work from the same day. Now we have come up with, in last 3 years, I have only come out with 5 or 6 diseases, validated protocols of assessment of those diseases on Ayurveda line, which is now missing in our Ayurveda education. But I am on the way and developing, and we are continuously developing. But when the issues issues day to day come up, all these literary works which these integrated protocol development process, it goes in the backlash. The new issues which emerge, they come on the surface. So this is very much required. But whatever we are doing at present with the modern research methodology, using all their tools, and whatever we can integrate from our side is very much being used, and whatever the cooperation we are getting from the oncologists, cancer hospitals and cancer societies, we are able to do, and we are ready to work. Even NIH US has also come up. And what is the status of the international organizations which come forward for integration works, research works? My experience is very bad since last 6 years. They all come forward for seeking funds. There is a very big bad point I want to emphasize on this platform. Everyone want money. Number 2, everyone want a molecule from Ayurveda. but no one want a Ayurvedist in that trial and in that work. This is a very painful thing for we people, and this will not happen. And I have stopped this one-way traffic. I will not coordinate or integrate in this way. Everyone has to contribute at their own level. They have to share the contribution, and then we can go. No doubt, Dr. Sriranjini, I agree with you. To develop an integrated protocol is a collective manner, and I have made a national team which is working under the dynamic leadership of one of the retired professor of a university, and we are on the way, and we go by the biostatisticians help. We go for the final validation, stage 1 validation, stage 2 validation, but this work is slow, but this needs to be a very fast. But the resources, the manpower, and the other responsibilities are so big that we have to leave these small. This is a small work in the eyes of others and policymakers and superiors, but it is a very big work which I need that I know that this must be done. I want to share with you a very small issue which we discussed, and we came out with the answer. We know there is the best definition of health is available in Ayurveda. You all know, samdosha samagni samdhatu malkriya prasannatmindriya manaswasthitya avdiyate. But have ever anybody tested someone healthy on this line with this definition? No. But my council now developed a tool that anyone through that app, I am going to launch it after the corona period goes away. Through that app, anyone can assess himself whether what is the status of his health. If he sees that, he says that I am healthy. If it is a poor health, it's a good health, how to improve it, we are giving the tool with it. You give this information to a doctor, Vaidya, and Vaidya will tell you, you make these changes in your lifestyle and diet, you need no medicine. You can go to the very good health status and excellent health status. So these are the basic issues. The concept of Prakriti. Every institution, every part of the country was doing its own protocol of 10 or 20 questions assessing the Prakriti. It was not standardized, but council could do with a 4 years rigorous work. But these fundamental works which we need, like integrated research protocol, this is a full-time job, and but according to the resources, it will go on. And I have initiated in the council. Even after I leave this council, this work should continue, and one day after decades we should come out with our method of research assessment. Pre and post assessment tools should be from Ayurveda side also, from system side also. So these are basic problems. And if in last I want to say, now the potential of alternate system, especially Ayurveda and Yoga, has been recognized internationally, has been recognized. Now a very big hospital near Delhi in Jhajjar is coming up with the central government support, where only Yoga center is being inbuilt in that hospital.
That's very nice of you, sir.
That is on the verge of commissioning. That is on the verge of commissioning. What we tried our level best from the ministry, that it should be a Ayurveda and Yoga center. So that, but it could not happen. But tomorrow it will happen. Tomorrow it will happen. Unless otherwise, under one roof where cancer patients are being treated exclusively. If the on a need basis, if the oncologists say that this is our limit, now you whatever you can do, you do, and a full independence should be given to the system so that they can approach individual patient with individual approach protocol, and they should show the result. The duty of the oncologist should be to evaluate the patient pre to sending to the Ayurveda treatment and post after they complete there, and what is the difference. That will create a evidence, and that evidence will be a authentic evidence. But only to say that Ayurveda should create evidence, even cancer patients are not being subjected to Ayurveda hospital. As I told in my presentation, only the leftover patients to whom they say you have a 6-month life, you have a 3-month life, we cannot do anything. You take your patients home, you provide him the best possible, and let him die. Those patients
That's
are by
important.
themselves coming to our hospital,
Yes.
and they are getting, even then they are getting results. And when after 1 year the same patient go to the same doctor, the doctor is surprised, you are still alive, how you are alive? They say, we took Ayurveda, we took yoga, and we are surviving. And
So,
then
I agree with you.
is not that evidence for them?
No,
Why,
pardon me, sir.
why they are not ready to work together under one roof? This is
No.
one of the question. And unless otherwise it happens, it will not work. No evidence will be generated, and only question marks will be only put. Thank you very much for giving me the chance.
Pardon me, sir. Thank you very much. There are two things here which we understand and we agree with you that there are two things which are hindering the entire process. And this hindrance is, one thing is when the patient comes to yoga physician or a Ayurveda physician, and the person is in initial stage, or maybe the initial stage of his diagnosis, which might be sometimes stage 3, grade 2 or grade 3. But then he has to go directly to the conventional medicine. But one thing is important, that we as Ayurvedic physician or yogic physician, we have to develop that kind of trust to the conventional medicine, because as we understand here that the rider for the whole world at this time in the medical system is conventional medicine. So conventional medicine is a rider, and when someone is a rider, you want to either share the steering, or you want to take over the steering. We need to give a confidence on them. So I agree that the Central Council of Research in Ayurvedic Sciences has already started putting things into track, starting from the very basics, like developing of the apps and trying to define the health status, number one, point number of health status, following to which there are different parameters which are going to be set, and maybe it will be coming in forward in the form of softwares also in future, which I can understand how Dr. Dhiman is expressing. On the other side, there was one question that in US, are the modern conventional medical oncologists, are they ready to really give space to Miss Diane, because or those people who are Ayurveda experts to really work on that. So maybe, hopefully, we will be having one oncologist later, adding to this panel, who is a medical oncologist from MD Anderson Cancer Institute, US. Along with that, Mr. John Kepner, who is also into the academic part to fix standards on learning yoga and Ayurveda at the same time. So maybe that will be the best question we should ask him about that how much a conventional medical system is really open, and if they are not open, or if we want them to be open, on what standards, on what level, so I think that will be he will be the best person to give that answer. In the meantime, what we see, Dr. Patil is working in a medical hospital and research center with medical college also, which is a modern conventional medical college, and he is integrating the entire yoga and Ayurveda with research there. So let's understand from him that what were the challenges and what are those things because of which he's able to do that integration. Dr. Patil?
Yeah, there are a lot of good views actually put by Dhiman sir and also Sriranjini madam. Here I just would like to make a very good important point, because where I am working in an institute, it's a medical college and also deemed to be university. It's a proud moment for all of us when we have started the yoga part of the curriculum of the MBBS. This is where conventional medicine in India. This is usually people practice yoga as just a wellness. It's not as a part of the curriculum. But our university made an attempt to bring yoga as a part of the curriculum. And now we have a yoga as a part of the curriculum in physiotherapy, clinical nutrition, and also in speech pathology and the other allied health sciences. So that's one of the good things. And also I just want to make a point here that earlier, as sir said, Dhiman sir said, a lot of challenges were there, but in the last decade, we can able to see a lot of tremendous changes has been happened. Not only at the ground level, it is also policy level. But considering the fact that this is not enough, but the things have been changed very drastically. Just I want to quote that Dr. Dhiman sir also doing a very good work in the, because we are one of the stakeholder there in the multi-institutional or multi-organizational study on a dengue, which is a very meticulous, it's a double-blind study which is taken by the CCRYN. It is completed. Where the two allopathy hospital along with an Ayurveda institute and also a ICIM, the National Institute Center, has been involved, brought under one roof by the CCRYN by funding. And this is one of the landmark study, I feel, once it is published, and it is almost the data collection has been end. But again, the challenges remains the acceptance of this, especially when it comes to Ayurveda for the conventional medicine people in India itself is a challenge. They are okay with yoga, but when it comes to Ayurveda, this is my personal experience being in a conventional medicine a hospital, where because yoga is a non-invasive and it is most of the time it's a complementary. But Ayurveda is an alternate most of the time, and it's an invasive procedure. And their way of looking at this Ayurveda is very different. So acceptance of Ayurveda by conventional medicine in India itself is a challenge. So, and there are certain other things I really don't want to touch. Maybe there is a pharmacological lobby and they really don't want we to be a competitor further. And already this COVID-19 time, Ayurveda and yoga, because the science have a potential. Maybe there are certain challenges. Now and maybe later it will come up because it's a time-tested science. And another important point where the Sriranjini madam also and DG sir also brought, we need to develop our own methodology. We are trying to search with their methodology. That's one of the major drawback what I feel. In certain areas it is right, as Sriranjini madam has told. But the challenges remain, because I also feel Ayurveda yoga cannot be practiced differently, because yoga is a mind level, Ayurveda is a body level, even though because the limitation of when it comes to yoga management, the mind management is in the Ayurveda. But unfortunately, there are two different councils, as I mentioned in the beginning. These are the things at a large scale need to be implemented at a policy level. Unless and until we do this kind of things, it looks maybe Ayurveda is entirely different and yoga is entirely. It is not so. If we just combine, maybe we can take a multi-arm study, one Ayurveda with yoga, conventional medicine all together. Then we can see the difference. Definitely, yoga acts as a catalyst for the medicine of Ayurveda, even in allopathy. So that things need to be taken. When it is planned when it is written by our ancient acharyas, they never thought, because repetition in the Shastra is an error. They not thought Ayurveda and yoga are two different things. As Ayurveda is a Upaveda of Atharvana Veda. So these are the things need to understand. When the Yogena Chittasya Padena Vacha Malam Sharirasya Chavaidekena clearly mentioned, for a Sharira it's Ayurveda and the Manas. So these are the integration should happen at one basic level. Then we can go for the conventional. And even still, there are a lot of good things happen, but still it is not enough, I feel, at the curriculum. The students are still not aware about because I have not seen, even though I'm trying to do several orientation programs, it is not applied for the Ayurvedic physician or Ayurvedic students in India itself, using yoga as a part of there. So integration happening at a student level itself is a challenge. So these are things to be looked in. Thank you.
Dr. Satyam, just a 1 minute comment. Dr. Patil has reiterated twice about separation of yoga and Ayurveda. He is very much right, 1000% right. Because I want to tell to the all participants what is life, what Ayurveda considers life. Life is a union of physical body, senses, the mind, and the spirit, soul. These four things, when come together in a contractual manner, one of the synonym of life is contract, anubandha. Then and then life is there. and we cannot address the issues of life but just by addressing the physical body. We have to take care of the senses, we have to take care of the mind, and we have to be think at the level of the spirit. So there is no issue that this science of yoga was subtly integrated with Ayurveda, and but there were schools who practiced separately later on. That's why it became a separate. But in the mankind service and addressing the life issues, the health issues particularly, we cannot think separately about Ayurveda and yoga. They are together, and now putting them separated, giving them an identity, does not mean that we cannot use them. So we will go together, and one day again Dr. Patil will come, that they'll see Ayurveda and yoga as a separate thing. Thank you very much.
Dr. Satyam, I think you're muted.
Okay, thank you, Ayuri, for letting me know that about this. So what I see here, that maybe just like in Ayurveda, how we have Shalya, Shalakya, I'll call it in English like ENT, then eye department, then we have pediatric department. So somehow yoga, which was always a part of Ayurveda, and Ayurveda, which is always merged with yoga, somehow as a different department, we started practicing it separately, and the world got confused thinking that they are different. Like if someone sees a person practicing Kaya Chikitsa and another person practicing Panchakarma and says that these two things are separate, we say, no, this is one thing. This is one thing called as Ayurveda. So altogether, when we call it as Indian medicine today, so it is a combination of yoga and Ayurveda together. So I agree with that, which has to be together, which has to, although learning and specialization can be done separately, but when it comes to the practice, it has to be practiced together. So we are waiting for Mr. John Kepner to actually join, so that we can go ahead with some further question and answer session till he joins. I think he just joined, so yeah. So till his camera is on and he starts talking, we can still discuss among ourselves. So one more thing which is important for us to understand, that outside India, how can we fix a different level of standard? Hello, welcome, Mr. John. We have here the Director General of Central Council of Research in Ayurveda Sciences. We have Dr. Nitin Patil, who is doctorate in philosophy of yoga. He is a doctor. Following by that, he has his PhD in yoga. We have academician and the head of the medical college, which is Dr. Ahliya Sharma. It's a principal of an Ayurvedic medical college. Along with that, we have Dr. Sriranjini, who has done her PhD from National Institute of Mental Health and Neurological Sciences, which is NIMHANS, Bangalore. And we have Diane Finlayson, who is from Maryland University, which chairs the yoga therapy and Ayurveda therapy education. So we are all trying to find out where are the flaws. We know what we have. Good thing we know. We are only trying to find out what we are not doing so that we can do. So in India, in US, in Singapore, and any other part of the world, talking about from your side, I will like to hear from your side as a policy maker, that when we talk about yoga therapy or Ayurveda therapy, what do you think that which is lacking, because of which somehow, no matter how great is this science, but still it is not able to merge?
Okay, you're asking me now to give a few words on this?
Yes.
Okay, I'm going to share my screen just to say a few things.
Yes.
But first, let me thank you for inviting me to join this group here. And I've been learning more about Ayurveda, but particularly as a client I love Panchakarma. So one of my goals is to make Panchakarma more accessible in the West, okay? So we'll have to work on that separately here. Okay. Can you see this one slide here?
Yes, yes, we can see that, sir.
Okay, you're talking about the part of it is what are the barriers to get yoga therapy and Ayurveda into conventional medicine? Okay. Now I'm coming from an association's perspective, but also from a yoga therapy perspective. But the way I see it is very parallel with Ayurveda. In the United States, we have a National Ayurvedic Medical Association that IYT works with very closely. We have very similar strategies. So everything I say will particularly apply to them as well. I'm mindful that I have Diane Finlayson on here, who is really just a distinguished educator in this field. So I'll say a few words. She may say a lot more. You know, she knows a lot more about Ayurveda than I do, and she knows a lot more about practical education than I do. So, okay, very briefly, there's a fair amount of research for yoga therapy. There's not that much research, as I understand it, in the West for Ayurveda. Okay, most of the research in yoga in the United States is done by researchers at the medical schools. And for better or for worse, there's just not that much funding for research for Ayurveda. If you guys know more about that, let me know, but I'm sure there's lots more in India. A big part of what IYT has done and our Ayurvedic colleagues is to develop what I call professional education, standards for the training of yoga therapists or standards for the training of Ayurvedic practitioners. And again, Diane is a leading educator in that, and her school is the only school in the United States that has a master's of yoga therapy from an accredited university. Another big thing is I call professional credentials. In the United States or in the West, we've worked very hard to have a credible credential for yoga therapists. Similarly, our colleagues in Ayurveda have the same thing, a credible credential. They have Ayurvedic lifestyle practitioners, Ayurvedic practitioners, and even Ayurvedic doctors in the United States. A big thing for all of us is financing. Yoga therapy is generally not, in Ayurveda, generally not covered by insurance. Let's look at Panchakarma, for example. It's relatively expensive out of pocket for practitioners, but not very expensive compared to traditional or conventional cancer care. And one of my long-term goals is to get more financing for yoga and Ayurveda in the conventional care. It's a long discussion. We're interested in that. Another barrier is the lack of education by the public about what yoga therapy is, as opposed to a regular yoga class. Similarly, there's even less understanding, at least in the West, of what is this thing called Ayur what now? I've been around it for a long time, and I see so many benefits of that, and it's so much, as you said, it's yoga and Ayurveda are like that. But that's not well known, at least in the West, okay? The last thing is, in the West, we are all over the world, not just the West, we're asking people to invest substantial amounts of time and money to be qualified yoga therapists or qualified Ayurvedic practitioners. Well, if you're going to ask them to, and that's a key goal of IYT, but to get professional employment, you have to have the research, you have to have the education, the credentials, the financing for this, and public education. So we're not there yet. In the United States and elsewhere, there are some people earning a real living, practicing as yoga therapists, and some probably maybe lesser as Ayurvedic practitioners, but not enough. So that's a key goal of IYT is increase the professional employment of yoga therapists, and similarly for Ayurvedic practitioners. I hope that's helpful for you. And I'm keenly interested in your comments and also Diane's on the comments on this here.
Thank you, Mr. John. That was nice to understand that there are certain things which are lacking. We understand that we have to re-incur and redefine professional credentials, which are somehow limited to the original place of Ayurveda. We call it as India, but these professional credentials has to be updated, upgraded, and has to be brought forward to the West and all other part of the world, so that we understand how these credentials work and how it can be well accepted all over the world. Along with that, yes, financing plays a very important role, because wherever any progress of any science is required, finance plays a very important role, and without that, the whole world cannot move. So that was input. Along with that, research, which I have no doubt that our DG sir, Dr. Dhiman, who is trying to put things in a better way, will be taken care of. But because here we are combining academics and research together, so that has to be well taken care of. So I think we can stop the slideshow from here.
Okay, whoops, excuse me. Okay, it's off. There we go.
Yeah, so we have people here, attendees here, who may like to ask some questions. So to all the attendees, I'll request you to switch on your camera, please, and raise your hand, because we have all the panelists here who are trying to answer your questions, where the theme is that why the Yoga Ayurveda is still lagging behind, although we have so much of research work and academic work going on. So anyone who wants to start here, you can raise your hand, or you can send the message to the chat, common chat area also.
We have Dr. Sharma.
Okay. Yes, Dr. Sharma.
Yeah, myself, Dr. Vibha. Sir, I just want to know from the DG sir that like in India, we have allowed to practice mineral compound. But being into Singapore, we are not allowed to do mineral compound. We are not allowed to do prescription of Rasa Aushadhi. Then how can we expect the good result? Like result for any cancer or any other disorder. So wouldn't be taken as a not only herbal, but mineral compound as an integrative approach throughout the world?
Dr. Bhiva, this is only the state issue where they have to give a permission, and when Indian population is surviving, even after taking herbal mineral formulations, so Singapore population is also having the same structure and same physiology. They can also survive. A lot of publications. There are a lot of publications in favor of their safety, clinical safety, and preclinical safety data is available with my council, and they can be put to the government, and government can be pressed that these are medicines which are fast acting, which are catalyzing in action, as well as a very less dose is required, and these medicines are in practice since centuries in the original country of origin of herbal mineral medicines. They should also be put for the benefit of the public of Singapore also. So that state has to take a call, and state has to give a permission.
Sir, but I think this is happening throughout the world. The herbal mineral compound is not allowed.
Yes. Now the last comment, my answer will remain same for all countries. My last comment is, when chemotherapy and radiotherapy, is it free of complications? Are they free of complications? When they can be used, our safe herbal mineral formulations can be 1,000 times more better way they can be used to the patients. So they should be compared in that way.
Sir, I understand, but the purpose of asking the same question is that why our Indian government doesn't approach this to other countries?
Everything is being done at policy level. It is not true that Indian government is not doing. We are putting every evidence with the international community. They are being published and they are all available with the websites.
That is why, sir, we be a Ayurvedic physician cannot give up 100% after settling into Singapore itself. Yes. We cannot show our good results.
I can understand your limitations without using these catalyst medicine, how you are getting results, but you have to manage. This is the law of the land, and you have to abide by the law of the land till the policy goes in the favor of use of these medicines. You have to abide with this. Otherwise, you come to country, India, and you use all those herbo-mineral formulations and serve the masses.
Okay, I'll add something here for Dr. Vibha. There are two things. One thing is what the entire research CCRYN is conducting. Following to that, when we talk about these kinds of medicine coming to the land here, even it is Singapore or Australia, the companies who are manufacturing it, they have to go through a separate testing, which is locally done. Like in Singapore, we have Health Science Authority of Singapore. So any pharmaceutical company who is basically making that medicine has to, even though it has been proven that this are the segments and this much is the milligram or micromilligram compound has to be there, but which is safe. So which gives a background. It gives a background that it is safe. So Health Science Authority is at least clear that it is safe, but they still want to go through one more testing in front of them with their, we call it as quality testing, QC control. So they will do that here. And if that gets passed, then the entire consignment is passed, which if I'm not wrong, they charge around, again, case to case basis, but they charge around 10 to 12,000 Singapore dollars for one consignment. And if that is being processed, they will let it go. And if it is not being processed, then the risk part is you have to bring the entire consignment back. So there are things which are happening in that way. But yes,
Dr. Satyam, these herbo-mineral formulations will not pass that test, because even in herbal formulations, they test the ppm limit of the presence of heavy metals and all those toxic things in that, in ppm level. When we are adding these minerals and metal-based medicines as ingredients in that formulation, how that can pass? It is not possible, because they are the ingredients. But there they want to say that by natural course, if in herbs these ppm limits are more even than they are toxic, so there is no question of passing of those herbo-mineral formulation through those tests, because the ingredients will be always be reflected in a higher level, which are the permissible limit, but that limit is for the herbal formulation without addition of any mineral. So that question has already been discussed at length, and that is can only be addressed when they change their law, when they change their policy towards this thing. Otherwise it cannot happen.
Okay, so there is a second question from Ms. Chloe, which is basically, I think can be addressed by Diane Finlayson along with maybe John Kepner, that when it comes to yoga therapy combining with Ayurveda therapy, so, and especially when it is back pain, a person is not able to move his neck. I should start with yoga therapy or I should start with Ayurveda therapy?
I think that depends on the patient and the needs of the patient, as much as it depends on the protocols that are available to the practitioner. So it depends on if you need to start, as we've been talking about, yoga therapy and Ayurveda need to go together. One is for the body, one is for the mind. And so does the client, the patient, need to have a little more clarification and calming of the mind, or do they need to have immediate relief of acute care in the back? That's how I would say you should think about it, is what is the acute need first? that will allow you to move in and give a more complete plan of care to the patient.
Dr. Satyam, will you read the question again?
The question was that a person comes with back pain, neck pain, and he or she has this problem. She's not able to move. So I should start with yoga therapy or I should start with Ayurveda therapy?
Number one, when it is an acute condition, you are not in a position to move, then no physical manipulation, even by physiotherapy nor by yoga. First of all, only certain physical measures, complete rest, hot fermentation, and some pain reliever. That can be from Ayurveda side, some Google or some preparation. And once the little movements and pain intensity reduces by hot fermentation as well as by rest, then and then any physical manipulation, even with the physiotherapy or yoga, should be done. This is the main line of treatment.
Okay, sir. So we have our second question coming here, that when I'm studying yoga therapy, so what I can see that I have to study a lot of anatomy which is related to not only muscles, out of the muscles and certain systems. Is it required, Mr. John?
Yes. The biomedical, as part of the foundations that are needed in yoga therapy and our standards here. So you do need to know enough anatomy and kinesiology as relevant to the practice of yoga therapy. So we have a certain amount, but you're certainly not up to what a physical therapist or maybe an MD might do. Diane, actually teaches all this. Diane, what would you say?
Well, Marlisa teaches all of this. I teach the theoretical foundations. So, so what I would say is you have to know anatomy, kinesiology, and some physiology too, because you have to know how what you're doing is going to impact the organs. You have to know about origins and insertions for the muscles, because you have to understand how the movements that you're taking the patient through, the client through, are impacting the body. And if you are going to work in an integrative setting and collaborate with a conventional physical therapist, many of the graduates who come through our program work in partnership with physical therapists, occupational therapists, medical doctors, nurses, in various settings. And if you are writing up a note, you have to be able to write up a note that's shared with the collaborator in a language they're going to understand. And they're not going to understand the yogic language that we might use, or the postures that we may be using, or the pranayama that we're using, or the meditation techniques we're using. So we have to find ways using biomedical language that will help explain to our partners what we're doing, so that they know how we're sharing our treatment with them. May I say one more thing? John mentioned that we were the only accredited graduate institution. There are actually 3 now. We are the only clinical yoga therapy degree in the US. There's a philosophy degree at Loyola Marymount, and the S. Vyasa School, Vivekananda University, is now offering a Master of Science that is state licensed in California, and their primary focus will be yoga therapy research. Yay.
Going to the next is, Amanda says that, why is it that the entire philosophy is limited to some Indian names, which is quite difficult sometimes for us to remember, with tongue twisting words, except except Arjuna and Krishna. So I think Dr. Patil should answer this question. Why is it the entire philosophy is limited to Arjuna, Krishna, and some tongue twisting words?
Yeah, it's a basic understanding. It just depends on the country, because we find it difficult to pronounce the names of a Singapore or China people. It is what we are used to. And basically, this Ayurveda yoga is an Indian origin, so obviously there will be a name of Indian, that will have a flavor of Indian language. I think that's the only logic I can able to draw. Maybe DG sir can add certain things.
This tongue twisting, Dr. Satyam, this tongue twisting will go away when you practice these words and this philosophy regularly. This tongue, as for us, the English has now become without tongue twisting.
She has given a name also, Ardha Matsendra Asana.
Yes. Ardha means half. Matsendra, this is the name of one god, and asana is the posture. So this is very simple. This is very simple. Ardha Matsendra Asana. So once you understand what is Matsendra, you learn about Matsyendra, who this rishi was, and who this person was, then you will always remember.
We have another question from Nurul. She says that as a yoga therapist, we have a challenge from public questionings. Why should consider yoga therapy to help my injury pain? She has a good. I think Nurul is there online. So Nurul, you can ask directly here.
So as a yoga therapist, we have a challenge from the public questioning why should we consider yoga therapy to help us with injuries and pain, because the popular mode of therapy here, I would say Singapore, would be chiro, physio, and osteopathy. So how would you approach a question like this from the public? Because I do have some challenge to convince them about yoga therapy, despite the evidences that I shared with them from a number of patients I work with, but still it's a huge challenge. Thank you.
I think this need a combined effort of Ms. Finlayson and Dr. Nitin, both one by one.
So if I may, I feel it's important, and we have so much education to do of the public, don't we? We have so much to do, and there's so much confusion between what is yoga and what is yoga therapy. So when someone comes to one of our students and says, well, I could go to the chiropractor or the physical therapist, the answer then is, that's good and it may help you with the acute condition. But when you work with a yoga therapist, you're going to get a full person approach to your needs. It's not simply looking at your rotator cuff or your knee. We're going to look at the whole person. Maybe we'll understand better how the injury came to be, and we can help you better prevent a re-injury. There may also be other things that come forward that can be attended to as well. We can help you understand how the injury came to be in the first place, for instance. And they may say, well, it's because I was playing tennis or I was running and I fell. Well, maybe something happened. Maybe your mind isn't clear. Maybe you're not paying attention. Maybe we can help you in other ways that you hadn't even considered. So I find with our students, when they approach their clients or the public who are questioning them, that these are useful answers, that it's a whole person approach. And there may be other things that need to be addressed and considered besides the immediate injury. And we can do that in yoga therapy. That's our scope of practice, to relieve suffering and then help that person become liberated. When we're talking about yoga and Ayurveda together, working together, this is another thing that gets forgotten, is that the relief of suffering is the beginning, and we can work to relieve the patient's suffering not just so that they're out of suffering, but so that they can have moksha, so there's liberation. So we can help free them in other ways as well, that they may not have even considered. Now, don't tell them that the first thing, though. That'll scare them.
Patil, Dr. Patil, please.
Yeah, I feel there are two ways, or maybe another dimension can be added for the acceptance. Because in India itself, we have a lot of challenges when it comes to conventional. Just visiting the history of Indian medical, how healthcare system has changed. Before British rule, the people were there, maybe before conventional this thing. It is completely destroyed. We have a lot of now, even including our convocation at present, has been happening in a British way. What I'm trying to say, over a period of time, they are able to overtake the existing thing with a continuous of bombarding the same thing. Here, I feel more education should be important, how we should educate, at the same time, good level of high quality of research. And if we are able to give a good clinical outcome for an existing patient, these are the three things. One is an education, orient the people about the clarity, what exactly. Second thing is the good quality research has to be done, which is still lacking, I feel. We are, compared to earlier, it is better, but it's still a long way to go. And third is important thing is the outcome. In India, a lot of folk people, they are not doctors. They are all traditional people, they are practicing. People are there in a queue for a kilometer. I'm talking in kilometer. I'm not talking in 100 meter, 200 meter. I'm talking a kilometer. People are in a queue to get a medicine from an unqualified, legally or maybe officially, but they are giving a very good result. They are not making a money. They are doing a services, and there are a lot of people. They are doing it for ages. They are maybe a family tradition. That's where the acceptance comes. Why public go, even though a whole qualified doctor himself for his own people, or for himself, or maybe his only family people, go in a queue to get those medicine for unqualified. In terms of, I'm telling BAMS or maybe MD kind of thing. But he's giving a result. That's where people are in a queue. I feel these are the three ways we can make an acceptance of yoga or Ayurveda. Not only yoga and Ayurveda is possible when we educate people, when we do a good clinical research or evidence-based, and when you give a very good clinical outcome. At the end of the day, patient want to relieve from his pain or his signs and symptoms. He's not really bothered in India. Okay, we have to read the mind of a people, give whatever needed for them.
If I may please come in for this question.
Yes. Yes, ma'am.
One specific answer to the question that was raised, yoga therapy and pain in injury, yoga and injury. One is the whole system relaxes when we take up yoga, and we have the local relaxation and the entire system relaxation. Once that happens, the healing gets better and the pain tolerance definitely is much higher, Therefore, the healing is faster when you have yoga for the injury, and a lot of papers go to substantiate this part. So one answer that I wanted to add, another dimension.
Thank you, madam. Thank you very much for that pain relief, pain answer. Now, LAD, please, you can unmute yourself and can ask question.
Yes, can you hear me now?
Yes.
So this session has been extremely useful in understanding all the difficulties along the way. And what strikes me is, although it's going to be a long road with lots of difficulties, you have so much in common, so much that you already agree on. And I want to know if if you can start the process about starting to agree on some protocols to document the research that you are all doing. Can you start agreeing on starting a website where you can collect information, where you can collect resources, when you can indicate clinics that you would recommend in all those countries that you already established, and start the process, which yes, may take decades, but start with what you all agree on to start building this process. And I feel that when that will help generating public awareness, that will help bring patients to those clinical research, that will help eventually governments to look into it and achieve all the goals that you've been talking are currently your difficulties. So that's my question to you all panelists. Are you able to start the process working together from this amazing conference that has brought you together? Can we keep that work and start a team a global team around the world to strengthen everything that you're doing now?
I think we need all three people here to answer. Dr. Ahliya Sharma, Mr. John, and Dr. Dhiman. I think all three have to answer one by one, because one is academician, second is from yoga therapy, and the third is from the research. So can we start with Dr. Ahalya Sharma, if possible? I think there is loss in connection. So in the meantime, can we hear Mr. John? Then we will go to Dr. Dhiman.
That was really a good question. Actually, a very astute question. I want to thank you for that. I'd also like to know where you're from, so I know where we're talking. Okay. IYT has a public website called yogatherapy.health. Yogatherapy.health. You're welcome to access that and use anything there. It's aimed at the public, so the public understands more about the difference between yoga teaching and yoga therapy. And it's aimed at healthcare practitioners, so they understand what yoga therapy is. It also cites some of the research. So to begin to address your question, that's one resource that IYT has developed. I'm sure there's others, but that's there now.
Dr. Dhiman?
Yes, I will
combining
answer
everything. He's saying that we have to combine everything and put it into one proper website, so that we don't need to go on 3 different umbrellas. We need to be at one umbrella, and everything we understand that this is something which is approved and we should start following.
If I can just clarify quickly, yeah. I think that the beginning, from what I understood, is, you are all facing this circle, this vicious circle, where you need the research to then be able to support the education of both people to come onto the profession, as well as convincing, insurance for coverage of the therapies, and governments to allow not only the practicing, but also the minerals and everything you need for the ingredients in the therapy. So it's about all of this. It's about everything you've talked about, because you are all working so heavily already in all those aspects. You're all facing the same difficulties. So can we start all these processes together?
The only shortcut answer what I can give, every country and state has to take a policy call upon that, depending upon the demand of the public, number one. And accordingly, when the government or the state will take a call upon this, making it legally possible, they will all go to the what is the evidence behind. They will collect everything, and then they will take a legal or policy level call to allow these systems. This is the concrete answer to that. This cannot happen only by hours effort. This will only happen when we convince your government and the public of that country put a pressure that we need these systems, we need these therapies to be incorporated in our health system, and we need a insurance coverage also, medical insurance coverage also of these therapies we are getting benefit out of. And one thing more, these publications and all research outcomes are from Ayush viewpoint. There is a Ayush research portal we are regularly maintaining, where the classified information of all systems is available. Ayurveda and yoga information is already, whatever the researches are going on, they are available on that website. And what we people of the outside the government or policy level, what we can do, we can make a international society for integrative oncology.
Yeah, thank you very much. That's very nice. We are actually thinking of coming up with something like that. That's why we want to really bring everyone. We want to bring IAYT. We want to bring CCRYS. We are also trying to bring Yoga Australia. We are also trying to bring European Union. So that's actually our thought, what we are continuously thinking, that how because our students, and especially Singapore, the way Singapore works is we are very open-hearted people, and that's how we talk in our national anthem also, we the people. So when we say like we the people, means everyone is us. So that is what is our thought, and thank you very much for giving that insight. We have Savita here, the last question of the day by Savita, and after Savita we will be watching live the launch or release of our souvenir booklet in front of our DG CCRYS, in front of our principal, Madam John Kepner sir, and our Diane Finlayson madam, and many others. So let's have Savita's question, and then we will go for the launch. Yes, Savita, please.
Yeah, hello, doctor. My question is to Dr. Dhiman or to any of the panelists. This is on behalf of a patient, like my friend's father, who is struggling with the 4th stage of cancer of lungs. And like at this stage, like what we can offer through yoga and Ayurveda. Thank you.
Okay, Dr. Nitin, can you add something from yoga? I will add from Ayurveda side.
Sir, you want me to first speak and then later you will add it? Yeah. Regarding to the 4th stage, usually a lot of challenges. As sir said, most of the people will seek this Ayurveda or yoga at the end of the last stages. If it is in an early stage, the outcome, the prognosis is actually always better. But in a 4th stage also, there are a lot of good things, because as per the present available literature regarding yoga, it cannot cure. But there are psychological disturbances, maybe anxiety, stress in the quality of life, and the other insomnia kind of issues and along with pain, fatigue, and other signs and symptoms, which is bothering a patient and impacting negatively the quality of life, can be improved by yoga intervention. And it depending on the which nature of a cancer, because tailor-made integrated yoga model can be advised that for that patient. Usually it will be a breathing practices and the deep relaxation like yoga nidra kind of thing will be advised usually in our practice, what we do in the 4th stage. Hope it is clear. It's regarding the yoga part.
Okay. So
yes.
May I know from Dr. Savita what is the status of his pain, sleep, and appetite?
Actually, he's about to be on ventilator.
So this is a terminal stage. Nothing can be assured from Ayurveda side also, but a psychological support and will only be helpful if cannabis leaves are available and officially allowed. Then 1 gram of cannabis leaves crushed mixed with milk and honey added with in place of sugar added with honey. If he is able to drink, then give 1 glass of such a milk daily to that patient for pain and anxiety relief. So this much I can tell at this stage.
Thank you, doctor.
Yeah, so we are going to see the launch in the presence of our panelist to be our witness, and thank you everyone. As the video goes on, Milling will start. Milling, will you start the video, please? In the meantime, I will keep talking till the video has not on. Okay, so it has been a great effort by all our team members to bring this up. Milling, you can keep continuing. Don't stop because of my words. You play and keep continuing. So thank you very much for all of you to really for contribution. Every one of you have contributed. I know that no matter it is our team, our students, or even the panelists, everyone took time to send letters, to send well wishes, to send videos, and finally with all these compilations, we are here releasing this souvenir booklet, which is going to be distributed worldwide in electronic format and in physical format in Singapore. At any point of time, if DG's office and other need any kind of soft copy or anything, we will be happy to share, because we want this to be going to many people all over the world, where we can say that we are all together here for one cause, to make sure that this integrative medicine can grow and we can give the best to the mankind, what is actually our final goal. We all will die one day, and that is for sure. But what we leave for our next generation, that is very important. It has been given to me from my teachers, which I can see here, which includes Dr. Sriranjini, Dr. Ahalya Sharma, Dr. Dhiman sir. At one point of time, they were my teachers. Today, they are still blessing me. And what I see as my students here, which are many, and then there will be some more students will come and you will be the teachers. So if this legacy continues, this will be something what we can set as an example. And for that, you all came together. So I'm really very thankful. And we end up the meeting from here with your blessings and always looking for your support in future. Thank you.
God bless you. God bless you, Satyam. And thanks to Orange. Keep on organizing such, and we shall like to listen about the international forum society for integrative oncology. And I think Singapore should take a lead, and this will make an impact on the international thought process on cancer, and we will work together. Good luck.
Thank you very much, Dr. Satyam, for this. I'm sorry, we had a small hitch in the hospital. We run a COVID care center, and therefore I had to be in and out. So we had developed some complications, and I couldn't probably be there completely. Thank you so much. Hope to contribute more next time.
Thank you.